Well, JCOIN stands for Justice Community Opioid Innovation Network. It's an $8.8 million grant from the National Institutes of Health, specifically the National Institute on Drug Abuse, with the overall goal of establishing partnerships between justice and community treatment providers in order to build capacity for the justice system to address the opioid crisis.
The Department of Corrections, unfortunately, has become the largest substance abuse provider across the state. We currently have about 6,000 treatment slots across the state, both inside and outside in the community that we're contracted with. Kentucky has the second highest rate of women incarcerated. So we want to make sure that we offer treatment for women that's geared towards their specific needs and give them that opportunity to be successful.
We know that women are an important population to serve because they have such unique needs and they have unique assets that can be brought to bear for a lot of social issues in our community. We also recognize that the role of children in their lives can be an important source of motivation and also anxiety in accessing treatment and then engaging in treatment long term. And so we know that if we can support women, then we also in turn can support their families and their children.
In practice, it's going to look like establishing telehealth linkages between jails and community providers in 6 different communities in Kentucky to initiate what we're calling pre-treatment services for women who are incarcerated with opioid use disorder, to do the initial screening, assessment, medical evaluation, and education around medications to treat opioid use disorder. And by establishing that telehealth linkage, women can engage with these community providers prior to release from jail and then enter treatment in those agencies when they're released.
When a person is incarcerated and they lose access to a substance, they lose their tolerance, which is an important protective factor in not overdosing. And so when they re-enter the community without access to treatment services and life-saving medications for opiate use disorder, their tolerance is depleted and their vulnerability is high. And so returning to use and using maybe the same dose that they'd used prior to entry has the ability to be lethal. Supporting Kentucky is important to me because it's an opportunity to serve my people, my family, my friends, my community. I see such strength and such opportunity in this state.
I grew up in Kentucky, I was trained at Kentucky, and I stayed at Kentucky. I really believe very strongly that these are our communities, these are our people, these are our family, our friends who have all been impacted by the opioid epidemic in really devastating ways.
No one wants to grow up to have an opioid use disorder. This could be your brother, your mother, your sister, your neighbor. What we want to do within the Department of Corrections is recognize that each individual has dignity and worth, and we want to treat them just like they were our family member and make sure that they have the opportunity to be successful, to receive the best treatment that they possibly can so that they can change their trajectory in life and do something different and be someone different.